Welcome back to Boom and Bust. I'm your host, Tony Clement, here with Colin Craig, president of secondstreet.org. Colin, what did your research show in terms of attitudes in the present day to healthcare?
Yeah, so the public opinion research, I think, shows that Canadians are ahead of elected officials when it comes to health reform. The three polling options or the three health reform options that we polled Canadians on, it showed that Canadians majority support moving forward with these measures. So one of which was pretty simple, and that was this notion of keeping our public universal healthcare system, but allowing patients to spend money at private clinics for procedures if they don't want to wait a long time in the public system. And 51% of Canadians agree with that option. They think that that's something that the government should move forward with. And if you think about it, when you look at other healthcare systems around the world that are universal, they don't do it the same way that Canada has. We have a monopoly essentially in many ways for government over healthcare services in this country. And so that forces everyone to use the public system. It puts a lot of pressure on the public system. And countries that outperform Canada, countries with universal healthcare systems, they give patients a choice. You can use the public system, or you can go to a private clinic and use your own money and pay for it. And so what that does is it takes pressure off of the public healthcare system. And so if you're on a waiting list for the government and someone ahead of you decides, well, they want to pay for it and maybe get it, in a week or two or whatever, well, that's great for you too, because you would still get it through the universal system. But now that this person ahead of you is using a private clinic, well, you get to move up a spot in line. And so that's one of the major benefits of this approach. And it's been done successfully in countries all over the world.
Mm. And what about private providers in the public system? So you get to still use your OHIP card or whatever health card you have, but it's the private providers who are providing the service. Did you poll on that?
Yeah, we did, Tony, and it shows that 64% of Canadians think that that's a good idea for governments to work with the private sector to reduce waiting lists. And if you think about it, we keep hearing from governments that they just don't have the capacity right now to expand the number of surgeries that are being done too much. We've heard that comment from government, and so if they hire a private clinic that can do it, well, then that's great. Because if you think about this from the patient's perspective, what do people generally want when it comes to getting their hip surgery or their knee surgery or something else? They want to make sure that it's done right, right? I mean, no one wants to have an infection or find out that there's a problem or whatever. They want it done right. And so when you have a private clinic, they have to follow the same standards that the public system meets. I would say the second thing that patients want to make sure happens is that they get that surgery done in a timely manner. No one wants to be sitting on a waiting list waiting for months on end, living with chronic pain, popping painkillers, watching life pass them by. So like I said, when you hire private clinics, it can help reduce wait times because you end up with more supply helping the public rather than less. And I think the third thing that Canadians are most concerned about is that when they get their knee operation or their hip operation or whatever, they don't want to walk out of the clinic and have to pay a big bill for it. And so when governments have used this approach, what happens is it's just like visiting your family doctor. You go in, you talk to your family doctor about maybe a cough or a sore shoulder, or whatever it is. And when you leave, you don't pay a bill. What happens is that doctor's office bills the government, and the government pays for it, of course, through the taxes
Right.
that they collect from all of us. So I think Canadians understand that this is it's an effective way to reduce wait times. It can be cost effective too. That's what Saskatchewan showed when they moved forward with working with the private clinics quite aggressively back in 2010. Fraser Institute analysis showed that it reduced expenses by about 26%. So it can be a very cost effective decision for governments too.
In a sense, you're right, this is nothing new. It's been part of our system. And what advocates are saying is it should be expanded, right?
Yeah, exactly. And as I just mentioned, it's for decades Canadians have gone to their family doctors. Those are private businesses, and like I say, they're funded by the government. Every time a patient comes in, that family doctor will bill the government for the visit. So, a lot of parts of the healthcare system are actually operated this way. Sometimes when you go to get your blood tested or maybe an MRI scan, Sometimes those are actually run privately, but they bill the government to pay for the procedure that you receive.
We're speaking with Colin Craig. He is president of secondstreet.org, talking about a recent poll that they had conducted on Canadian attitudes towards healthcare and healthcare reform. We can take another brief break. We'll be back after that. Please stay with us.